Guys, today we will be talking about the ischemic heart disease, right? Now, what is this? What is ischemic heart disease? It is a heart disease which is due to ischemia. Now, ischemia means three things, right? Ischemia means three things, that is, decrease in oxygen supply, and obviously there is also nutrient supply deficiency, as well as there is decrease in the removal of the waste product of the heart, right? So this is ischemia. Now one thing you should know that what is the difference between isolated hypoxia and ischemia. Now in case of isolated hypoxia, there is only hypoxia, that means only there is deficiency of oxygen supply, but there is no deficiency of normal nutrient supply or removal of the waste product of the heart, I mean, right? So that is isolated hypoxia, and ischemia means there is decrease in all three things, right? Now normally, mainly the ischemic heart disease is occur in 99% of the patient in the left ventricle, because the left ventricle has a more thicker wall, and there is more pressure in the left ventricle. That is why the intramuscular blood vessels which runs through the myocardium, that is more compressed because there is more pressure, right, in case of left ventricle. But in case of right ventricle, it is quite less common than that of the left ventricle. In right ventricle, it may be due to right ventricular right ventricular hypertrophy that is seen in the pulmonary hypertension, and also when there is right coronary artery blockage, right, vessel block. Now I'm going to show you uh, what is atheroma or atheromatous plaque. So atheroma means lipid rich intimal lesion, right? Lipid rich intimal lesion. Now it may be of two type, one is stable and another is unstable. Obviously in unstable, that is more riskier than that of the stable. Now I'm showing you the images, right? This is the image of the stable plaque, and this is unstable, right? Unstable. Now why unstable is dangerous, why more risky, I will uh, telling you I will be telling you, right? So in case of stable, what is there is a much thicker fibrous cap, right? This cap is much thicker than that of the unstable. As you clearly appreciate, this fibrous cap is made up of smooth muscle cell and collagens, right? But in here it is not much thicker, it is thinner as compared to stable. And in the under this fibrous cap, there is lipid core, and these are lipid rich macrophages, which is known as foam cells, right? So when there is a stable plaque, the lipid core and the proportion of the lipid is much lesser than that of the unstable. In the unstable plaque, there is more lipid, right? So there is more macrophage lipid laden cells, more foam cells and more macrophages, right? So another thing you should know, that macrophage secretes metalloproteinase, right? So this metalloproteinase causes destruction of the fibrous cap of the fibrous tissue, that also causes the thinning of the cap in case of unstable, right? So also there is a neovascularization here, right? Neovascularization occurring because all the cells, the foam cells, the macrophages, the smooth muscle cells, everything here are, they secretes a growth factor that causes this uh, neovascularization. But there is a one problem. What is the problem? This is the endothelium, right? Now when this is not normal endothelium, right? It is dysfunctional endothelium. Now what happens normally? uh, yeah, unstable plaque is why it is more dangerous, because it is unstable, right? So here also the neovascularization is takes place, and when there is neovascularization is takes place, there can be leakage of blood from here to the lipid core. And when this is occurring, this is the blood vessels, right? Now this is unstable, and the fibrous cap is also weak, so there is it is enlarged and causing more occlusion of the blood flow, right? So it is dangerous. Another thing that is this, this fibrous cap is weak, so there when there is much more pressure by the blood flow, right? So then this fibrous cap will be broken, and all this this thing will be exposed here, and the subendothelial, this is the endothelium, right? So when the endothelium become damaged by any means, right? So there is subendothelial subendothelial collagen is exposed. And what happened normally when there is subendothelial collagen is exposed? Now platelet becomes adhered to this, right? Now this platelet, look, here is two things there: platelet aggregation and platelet adherence. Now what is adherence and what is aggregation? Platelet adherence means there is attachment of two different kind of between two different kind of molecules. Platelet, when attaches to the subendothelial collagen, right? So there are two different things, so this is known as platelet aggregation. When platelet adhere platelet attached like this is known as platelet aggregation. And with platelet adhesion, now when platelet adhere to the subendothelial collagen layer, then it releases some factors which attracts more platelet from the flowing blood, and that causes more platelet to be attached on existing layer of platelets. And this platelet attachment is known as aggregation, because this is between the same molecule, that is platelet and platelet is all attached here. The attachment is between two molecules of platelet, that is the between two molecules, between two same kind of molecules. So this is known as platelet aggregation, right? And when platelet aggregates like this, this is known as platelet aggregation, right? So here, now one thing you should know, sometimes we might confuse what is aggregation and when it is said coagulation, right? So you should know that when the term coagulation is said, that simply means the fibrinogen is converted to fibrin. So this is coagulation. And here also the same thing happens. Here the fibrinogen is converted to fibrin over this platelet aggregation, and this is known as coagulation, right? This portion is known as coagulation. And this coagulation and the platelet aggregation together, they togetherly known as thrombus, right? They're togetherly known as thrombus. Now what is erosion? There is the erosion of plaque. And what is the rupture of plaque? It is also called erosion or ulceration of the plaque, and rupture or fissuring in the plaque, right? So erosion means only the dysfunctional, this is the dysfunctional endothelial, right? The endothelial layer is ruptured, so this is known as erosion. And when it is completely up to here, the whole thing, the endothelial layer and the fibrous cap, the whole thing when damaged, then this is known as rupture, right? So when there is only damage of the endothelial lining, this is known as erosion, and when there is damage of both endothelial as well as the fibrous cap, this is known as rupture or fissure. Now what is happening in case of acute or dynamic changes? That is acute change, that it mainly occurs in the unstable plaque. So there is erosion, there can be erosion and there can be fissuring, and when these two things are occur, there also can intra-plaque hemorrhage, right? Because there is neovascularization here, right? But normally it is mainly occurring in case of dynamic, I mean unstable plaque, right? So this is up to here. Thank you guys.